Hi, my name is Mary Wong, and I am a registered traditional Chinese medicine practitioner and acupuncturist. Today, this is my third live feed, and I plan to do weekly, now starting Wednesday evenings, Eastern Standard Time, 9:30 p.m. Today, the topic is navigating yourself through early pregnancy. Currently, I have some patients that are waiting to find out if they're pregnant and some that are actually pregnant, and there are lots of questions that come up. So I want to cover that to help you perhaps decrease some of the neurotic thoughts that we have in our heads when we're going through this. So this is an interactive live feed, so if you have any questions, please go ahead and do type away and send me some questions. However, for those that want to keep more private, you can also send me a private message, and hopefully I'll get that, and we shall cover questions. So let's start. So let's say you just get your pregnancy results at home. You're gonna probably and likely will take a pregnancy test, a urine test, and just to speak and address that, oftentimes, let's say someone's doing an IUI or they're doing an IVF, and the 2-week wait is like really difficult. So oftentimes it's not that uncommon for people to take a pregnancy test through urine sample at home before the 2-week blood test. And I try to advise against that, because sometimes you can get a false negative, and before they catch the HCG level, which is the pregnancy hormone that you would get that is developed. So try to hang out and like hold out for the blood test. And when you do get a positive, some people look for symptoms and signs of staying pregnant. Well, the truth is everyone experiences pregnancy very differently, and some feel symptoms and some are completely asymptomatic. So you can go from not feeling a thing to having breasts and nipple tenderness to nausea, and typically early nausea is not prevalent at 4 weeks of pregnancy. And so don't really expect those kinds of symptoms early on. Now, the other thing I want to address is when you are pregnant and doing IUI, IVF, you tend to take supportive hormones such as progesterone, like that. And again, that can also induce symptoms for some women, and some women have no symptoms. I want to tell you that there are symptoms of pregnancy, though, that you may or may not feel, and I'm going to go through that with you. So one of the most critical one I find that most people experience is fatigue. And if anything else, if you're more tired than normal, that is an awesome sign, because just so you know, as soon as you're pregnant, what happens is that your blood volume doubles. Your body is quickly trying to make like super highways of blood vessels so that it feeds the developing embryo. And as it does that, it takes a lot of energy from your body, so you may be very, very tired. So that's one. And breast tenderness, as I mentioned, that can be also another common one. And during pregnancy, please, please, please know that breast tenderness can go up and down. So I've seen lots of women panic when one day they feel their breasts being sore, and then the next day they don't feel it at all, and they're like, oh my gosh, it's not happening. And yet really the symptoms wax and wane as things are growing and developing. So don't worry about that. And again, morning sickness, you hear about it, that it's a normal symptom, but not everybody gets it. And also morning sickness, I find, is actually more typical to be more afternoon sickness or discomfort than there is morning sickness. So I find that an interesting name. Acupuncture can treat those kinds of symptoms quite well and readily, to the point where I've in fact had some patients complain to me and say, Mary, you know what, you took away my nausea, and I want to feel some level of it because I want that comfort of knowing that I'm still pregnant. So, but if you're like quite nauseous, it's an excellent, excellent tool. And there are other ways to deal with nausea when you do have, when you are pregnant. So some tricks we do, we want you to have lots of water during pregnancy. And for many, early pregnancy or even throughout the pregnancy, it's actually difficult to take in water. Like, it makes you kind of sickly. So you could have ginger water or ginger tea. Some people do ginger ale, but you know, there's a lot of sugar in that, and it's quite, well, it's just not good for you. So real ginger tea, cooking it up. If you can take that, great. And there's also natural ginger candies, that's good. They have these lollipops that have, oh, I forget the name of it, but basically it has vitamin B in it, and that can also help with nausea. Pregnant pops, something like that. I'll have to get that to you another time. The other thing is bubbly water is often good in of itself. Maybe squeeze a little bit of lemon. And the other thing to note is when you're a little nauseous, to keep your blood sugar levels even. So eating literally every hour, maybe every 2 hours, but don't go long stretches without eating, because that can increase nausea. And when I say that, it's not like eating full meals. And in fact, what happens is typically when you're pregnant, you don't have as much of a ravenous appetite. So it's better to have smaller meals or and snacks in between. And the snacks, what to eat, preferably some sort of like a easily digestible protein, so more vegetable based, nuts, seeds, lentils. You could do like hummus, which is like chickpeas. There's like chickpea snacks. So these are all protein. And if you think about building life, life is made out of protein. So adding more protein is great. And you know, the heaviness of meat, in fact, lots of people are turned off of meat, so you might not want to do that. So that is about food. Oh yes, when women are pregnant, one of the things is it took you this long to get here, and you've had this pristine diet. And one of the concerns is, oh my goodness, now that I'm pregnant, I have to make sure I eat healthy, but I feel like crap, and I really can't fit anything in my belly. So then you have cravings of, you know, carbs like crackers and white bread, Wonder Bread. Fruit is common. Fruit, that is great, but there's a guilt about if you want and crave carbs. Well, I say in this phase, it's actually okay to succumb to a little bit of that. And the reason again being is that your body, I equate it to you're doing a marathon a day. When you are building these super highways and feeding your little developing embryo to become a fetus, this growth requires a lot of energy, and sometimes the quick energy is okay, and it'll tend to help with nausea. And you know, more in the second trimester and third trimester, I want more of a well-balanced diet. That's when you can be a bit more anal about it, if you will, so that you can prevent any kind of gestational diabetes. So let's go on. The thing about being pregnancy, the other thing is that women want to keep positive, right? So again, I've said it in the past, I think it's also really important to be true to your feelings and not shoving it down. So when you've had a miscarriage in the past, or if you are a woman having secondary infertility, there's just going to be a lot of worries, and it's natural to go through them. So if you just pretend and shove it down, try to be positive, it's just not real and authentic to yourself. And I think in that way it poses stress in the body as well. So what I say is acknowledge your stress and don't stress about being stressed, and maybe find other things that you can do to decrease your stress. So avoiding negative self-talk is one. So instead of just feeding into the negativity that may be there, just know that, for one thing, I would say, myself personally, when I was going through fertility issues and I was actually pregnant with my daughter, one of the things I said was, I'll believe it when I see her in my arms. And then literally I would do that. But instead of really being negative, I would just breathe it out and think about going back into my present space and talking to myself and saying, are my thoughts real, and are my thoughts the truth? This fear, is it the truth? And I say, no, it probably isn't. And look into your day, and that's where I practice gratitude. And for those that have been following me, I post, and I have been posting for close to a year now, what I call the Gratefulness Project. And the reason behind that is that I tell people to think about what to be grateful for every day. And I wanted to practice what I preach, and doing so, I personally have noticed that when you practice gratitude on a daily basis, it has you reminding yourself that even under the worst of circumstances, if your husband pisses you off, or work is not working out the way it should that day, I just remember to find something to be grateful about. And then it seems like the stories in my head, the drama in my head just becomes less. So the neuroses of early pregnancies, by the way, I'm not blaming people for being neurotic during pregnancy. It just is. It's it happens for anyone that has been trying to conceive for any amount of time. And it's normal to be a little neurotic during pregnancy because we have fears, right? So what do you do now when you encounter bleeding? Well, this just happened recently for a patient of mine during pregnancy. And of course, the worst fear comes up. Oh my gosh, I'm going to miscarry. But the truth is, you may not miscarry. And I think, again, I said it last time, a lot of my patients do, including myself, have bleeding, spotting during pregnancy, and it may not necessarily mean demise at all. Of course, you may want to get it checked out to be sure, but oftentimes, especially those that are doing suppositories or any kind of progesterone supplementation, there's oftentimes even little bleeding from irritation. They're you're supersizing your lining, so maybe there's more of a capacity to bleed. There's also just a lot of people that get blood clot, the subchorionic bleed that I mentioned last time. And that can carry on first trimester. I've had some people even have it in their second trimester. And one lady recently, she was getting initially some light pinky spotting and then light brown spotting, and it was going on daily. She had it checked, baby was there, the heartbeat was there, so that gave her some confidence. And after she spoke to me especially, because it doesn't necessarily mean a demise, okay? And sometimes you can literally get a large chunk of a blood clot that can come out. It can either recede and be absorbed, or it can literally bleed out. So when it bleeds out, you may panic, but if you know that you have a subchorionic bleed, then don't worry about it as much. And really, the bed rest that they used to say doesn't really work. You can still work. I worked during the time I was bleeding. I would kind of sit down more, but I think that if I was sitting at home, that would make me freak out more. So I suggest that for yourself as well. So speaking about getting tested, I also find that when you have more rigorous intervention to try to conceive, there's also more rigorous testing. So in the first actually some clinics, it's 5 times every other day they do a HCG level test. And I don't know if it's a blessing or a curse, because what I find is that people panic between testing times, and that also waiting for the 7-week ultrasound. And some women, in fact, today I heard one woman was going for an ultrasound at like 5 weeks, and the doctor said, oh, you know, be ready for a miscarriage, because they said, oh, I don't really see a gestational sac. And I think that's just really not a good time to get ultrasounds. So my recommendation to you is get an ultrasound at 7 weeks, and prior to that, do just the beta HCG blood test. Because at 7 weeks, you should see a heartbeat. And before then, it's really all about checking your HCG levels, doubling every 48 hours. And addressing that, not everybody gets a doubling of the HCG every 48 hours. And I have certainly witnessed people that even start off with a very low HCG, like, you know, I've had it at 40 or 12, and they still become a baby. I've had some people start at 300, and that's a baby. So I don't like to really focus in on the numbers, as long as it starts to double. And even then, it may not double right when they take the blood test. And sometimes the doubling rate is maybe like an hour or two after your blood test. So it may not be doubling yet. If it goes down, then I'm sorry to say that is going to be what we call a chemical pregnancy. So it will not survive. And when it comes to the ultrasounds, so when you have different clinics working with you, sometimes they give you weekly ultrasounds from 7 weeks, and other times they go from 7 weeks and straight to 12 weeks. A normal pregnancy, like if good old-fashioned way, you get 0 ultrasounds. You get 1 blood test, and then you get your nucleotranslucency test, where they check the measurements of the developing fetus at 12 weeks. So from 1 blood test to 12 weeks, there is 0 monitoring. So for some, you can live your life versus going between testing and panicking from one visit to the next. And then also consulting Dr. Google is not necessarily the greatest thing either. So just take it from me. Also look at how you are with this. If you find yourself panicked and you need to know numbers, fine, feed into that neurosis. But otherwise, if it's better for you to not know, then, you know, try to have less testing. Does that make sense? I haven't had anybody add in a question yet, so I'll just go on a little bit, and then I'll leave it to you to jump in anytime. Back to symptoms. Oh yes, there is definitely emotional sensitivity, but you probably know that anyway. Heightened sense of smell can be a normal symptom. Cravings or aversions of foods, certain foods. Increased urinary frequency, changes in libido. Shortness of breath can occur. And one thing I do want to mention too is in terms of like twinges in the lower abdomen. Some people in fact, lots of people, most people will feel twinges in their lower abdomen, basically where the baby's going to be developing. And sometimes it feels like a cramp, and there's a little bit of a freak out and panic too, because typically women are thinking, oh my goodness, this might be like a miscarriage cramp, or I'm going to get my period. But it may not necessarily be that as well. So know that that is all normal. So what are my advice to you during pregnancy, especially early pregnancy? One of the things I say is keep yourself in a happy bubble. And what that means is stay away from news. Any news is really bad news, because that's what news is. So, you know, watch more movies that are funny. Don't watch horror movies or thrillers that gets you like this, in which you may, you know, seize up your uterus, and we want things nice, loosey-goosey and relaxed. And this is not the time to take on extra work early pregnancy. I would suggest, you know, just staying with the course. try to sleep as much as possible, getting rest where you need, giving yourself permission to sleep on the weekends. And oftentimes, as I mentioned, people are fatigued, so right after work, all they can do is go straight to bed. And if you need to do that, fine, go for it. Try not to be your regular self. And some of you may freak out too, that during early pregnancy, or maybe even throughout the whole pregnancy, you may have insomnia. And sometimes it is drug induced, sometimes it is just hormonally induced. The bladder, you may be having a more active bladder, so there's sleep disruptions there, and that should not pose a negative impact on pregnancy. I say also as an advice to connect with the people you love, be around people you love, around people you like, rather than be, again, in stressful situations. And, well, one very important thing I think is to get off those chat lines where there's a lot of negativity. I know you like support, but recently I've been going on a lot of different chat lines, and there's a lot of negativity, and I don't think that's a great space for you when you're pregnant. And that's what I have to say about that. So if you really have to go on Dr. Google, maybe limit yourself instead of going on hours on end. Just limit yourself to like 30 minutes, and just don't get confused, because there's a lot of conflicting information out there. All right. Last thing, well, of course, I have to plug this in. Go for acupuncture, because acupuncture during pregnancy is very safe. It's drug-free, so when you're experiencing any kind of symptom, which includes nausea and vomiting, or even stress and tension, acupuncture is an excellent way to treat that. And there's a heck of a lot of great practitioners out there in your area, and you just have to look it up. In the US, I would consult FABORM, which is the American Board of Oriental Reproductive Medicine. And in Canada, in Ontario, you can certainly find practitioners as well. It's difficult because our college is not open to telling people who the practitioners are, but there you can Google. Okay, so I think that's about it. And thank you for watching. And next week we'll be on for next Wednesday at 9:30 p.m. Hope you've learned something here tonight, and I look forward to being with you next week. Okay, have a great night. Bye.